Good day, viewers. Welcome to today's podcast, which is on a very ranging topic, the Nigerian space. I still remain your host, Dr. Kolawole Olayimbabatayo. Our topic for discussion today is on religion, cultural beliefs, and healthcare delivery challenges in Nigeria. I can assure you today that the topic under discussion will have a far-reaching positive value in your life. I bring to you today a well-experienced healthcare professional who is going to be doing justice to the topic under discussion. My guest here today has well over 18 years practical experiences in the healthcare field, both in Nigeria and in the United Kingdom. And she holds a lot of academic qualifications that make her an expert in this particular area under discussion. Our guest here today is registered with NMCN Nigeria, and she holds a perioperative nursing certificate from the University College Hospital, Ibadan. She holds a Bachelor of Nursing Science degree from Obafemi Awolowo University, HND in Public Health Nursing. She also holds a Master's in Nursing Science, specializing in Community and Public Health Nursing from Babcock University. She also practices in the United Kingdom, and she is duly registered with NMC United Kingdom. Join me today as I welcome to this podcast our guest, Mrs. Oluwatayo Babatayo. Good morning.
Good morning. Thank you.
Okay,
Thank you for having me.
Thank you very much. We do appreciate the fact that despite your busy schedule, you were able to honor our invitation to speak on this particular ranging topic.
Thank you.
Thank you very much.
It's an honor.
Okay, let's go straight to the business of the day.
Yeah.
Religion, cultural beliefs, and healthcare delivery challenges in Nigeria. Religion. I will start by quoting an article written by Timi Walaye in October 2023 of the Pew Research Institute. It was reported in the research that Nigeria was the fourth and fifth most religious country out of the top 10 in terms of Christianity and Islamic religion in the year 2023. Also, Nigeria is reported to have well over 250 ethnic nationalities with diverse cultural beliefs. This brings us to the fact that religion and culture play very prominent roles in every aspect of the Nigerian space. That takes me to the first question to our expert today. As a healthcare expert, do you think that religion and cultural belief play a very influential role in the total acceptance of healthcare delivery services in our communities in Nigeria?
Yes, it plays a very vital role. It does not only play a role in delivery of healthcare, it also plays a value on how people perceive their health, how people perceive illness, and how people perceive death. So it has a very vast role that cannot be underestimated in our healthcare delivery system.
Okay. All right. Thank you very much. Okay. So that takes me to a leading question from your response to the first one.
Okay.
Is the fact that, in your own opinion, do you think that the roles that religion and cultural belief play in Nigeria, as you have mentioned, in the healthcare sector, are they positive or negative?
Yes, I would say it's both ways. It's both positive and negative.
Okay.
We cannot exclude the issue of religion and culture in our healthcare delivery system. In fact, for you to provide an holistic care, because we give an holistic care, we don't give partial care to patients. We make sure when you are giving care to patients, you make it holistic. Okay. And for you to make it holistic, you must involve both the religion and the cultural value of that patient to make it complete. Okay. Do you understand? So I will start by talking about the positive values, the positive roles that religion and cultural value plays in healthcare. First of all is the fact that you go to mosques or you go to church to worship every Sunday or Fridays gives you a sense of fulfillment. A place of worship is a place that you have joy, is a place that you can relax, which subsequently can lead to lower blood pressure, lower heart rate, and give you a sense of fulfillment at the end of the day. So you see, it's a way of creating a positive value in your healthcare. And when another positive role is that in our mosques and churches, we preach against some social practices that is not good. So religion and cultural value reduces all these social pathologies. Let me go for that so that you can really understand what I'm trying to say. When we want to talk about crime rates involving in our youth or our young adults involving in crime, all these churches and mosques, they preach against all this for our youth growing up. Don't involve in criminal practices, don't involve in drug addiction, don't involve in any practices that can affect your mental or psychological well-being. So these are ways that it affects us positively, because when you don't involve in drug addiction, definitely the issue of affect your mental or psychological well-being. So these are ways that it affects us positively, because when you don't involve in drug addiction, definitely the issue of having mental problem will reduce to a limit. And if I want to talk about the negative values, the negative value is that it does not really allow us to seek medical treatment on time. You see so many people when they are sick, even if it's just having headache, most of the time we tend to believe headache is small. We say, I have small headache. I've been having this headache for the past 2 days. I've been having this headache for the past 5 days. And you just take it lightly. You just believe that there's nothing more. Let me just take anointing oil. Let me just take Omi Abira. I'm not against that, because I'm also a practicing Christian. Okay. But at the same time, I believe that you don't take your health, you don't take it lightly. When you see all those things, you make sure you seek help on time. You don't say, it's just a minor thing. And some people, it got to an extent that they will tell you it's village people, in quotes. That's our word in Africa, especially. We believe if it's village people. I've been having this stomachache, I've been having this chest pain. Is somebody I fought with last week that is probably the cause of this? You know, all these type of things. So it does not really allow us to seek medical treatment on time. Secondly, it doesn't allow us to adhere to our treatment regimen. Not only drugs, but other treatment regimen like chemotherapy, like life-saving treatment like blood transfusion. You see that there are some religion clearly that they don't allow that during treatment. So these are ways that all these religion and cultural values can really affect us. But in as much as it has its own positive aspects, it starts its own negative aspects. It also has its positive aspects.
Thank you very much.
Yeah.
For the response they have just given. So religious and cultural beliefs have positive and negative aspect or negative influence on the total acceptance of healthcare delivery in Nigeria. So as we go along, we see which of them outweighs the other, whether it is a negative or it is the positive aspect. Yeah. Now that takes me to the second question for our guest here today. There are instances in Nigeria where we've seen some of our religious leaders openly preaching against their members going to the hospital for treatment when they are sick. It is even as bad as to the fact that some of these religious leaders even believe that when you have slight illness, like you're having an headache, you cannot even use paracetamol. Because they believe that it is against their religious beliefs. Some even believe that it is a sin for their members to use any medication, as low as it may be, even if it's paracetamol. So they believe that if you use that, it is against your religious belief. Do you understand? So my question now is, what do you have to say about this?
Well, that's very funny, honestly, because anytime I listen to some programs or preaching on TV or social media, we see some of our pastors read and we say, I've not been sick for the past 6 months, I've not taken paracetamol for the past 10 years, I've been alright, if you believe in God, if you do this. But like I said earlier, in as much as I believe so much in God being the great physician, it's in the Bible that our God is the great physician, accepted, we know that. But God gave humankind the act of healing.
Okay.
God gave God gave human the knowledge to go into all these courses, medicine and others, for healing process to take place. God will not come down from heaven to just come and heal us. It must pass through some people, and I think that's why God gave these courses, healing acts, as a process, using human as a factor to help us.
Okay.
Do you understand what I'm trying to say? So to help us in the healing process. And there's nothing in all these things that we use, all these drugs, paracetamol, flagyl, and so on that we use, that most of them are from all these natural plants that God himself created. So, and there's nowhere in the Bible that there's a restraint on don't take drugs. I know there's nowhere in the Bible, and I'm very sure there's nowhere in the Quran too that is written that don't take drugs. And to even mention, to even look back, we see that most of our old doctors in the olden days, even at present, most of them are Christians. Most of them are reverends, they are preachers of the word of God. And we have enough medical researchers that are Christians, that are Muslims all over the world. So there's nowhere in the Bible that is saying that drug is the sin.
Okay.
I don't think I believe in that.
Thank you very much.
Yeah.
You just heard that our guest here has said she, as a Christian, she believes that there's nowhere in the Bible where the Bible is against people taking medication when they are sick. If you think otherwise, you can drop your comments. Thank you. That takes me to the third question to our expert here today. In some part of Nigeria, children that were born with sickle cell anemia were stereotyped.
Okay, yeah.
And they are, even till now, they are still being stereotyped. As perhaps maybe they belong to Emiri or Banje, you know, all those things. That's why they are falling sick here and there.
Yeah.
So, and this stereotype, you can drop your comments. Thank you. That takes me to the third question to our expert here today. In some part of Nigeria, children that were born with sickle cell anemia were stereotyped.
Okay, yeah.
And they are, even till now, they are still being stereotyped. As perhaps maybe they belong to Emiri or Banje, you know, all those things. That's why they are falling sick here and there.
Yeah.
So, and this stereotyping is sometimes related to dictate of the cultural beliefs of some of these communities. You understand? So, in fact, even as we speak, in this 21st century, I have a friend whose sister was having issues like about a year ago, anxiety issue, and she was having BP. She couldn't sleep. From that, she was developing high blood pressure.
Okay.
And before you know it, they believe that it was the spirit that were after her. So, and she said they took her to a spiritualist who said she belongs to that she belonged to Emiri, and they needed to detain her for 7 days for spiritual prayer so that they can chase away the Emiri, you know, so that they would not be able to disturb her again. They collected money from her. Unfortunately, after everything everything was done rather, the 7-day detention, prayer, all the money, she was still having that anxiety. She couldn't sleep. And she was still having the high blood pressure. So not until she was able to meet with a medical person who now diagnosed and discovered that the symptoms she was having, they were just symptoms of menopause. That she was approaching menopause. That's why she was having all those anxiety and all those things. And they prescribed drugs for her, and she discovered that she was far better, and she realized that it was just a mere cultural or religious belief that you know, understand. So, but the question is, she's already a BP patient as we speak, just because of that. So, my question to you is the fact that in this age that we are, in this 21st century, do you still believe that? Okay, sorry. What do you think? You know, for what we've said now, what do you think that the medical associations and the healthcare professional association, what can they do to enlighten people against, to put enlightenment to people if they have such type of cases?
Okay.
Yeah.
Yeah, that question is so funny, and it makes me remember some things back then when we were during training. That any little ailment, we just believe is the work of the devil. Is village people. Every of our things is village people, and I think what the healthcare professionals all over can do is, because according to WHO, that is the World Health Organization, one of their core mission is to promote health and make sure the world is safe. So the healthcare professionals, what they can do is just to create, to make sure there's a life-saving programs that can be done from time to time, and also there should be enlightenment and awareness of all these diseases, of all these ailments, and also of things that is expected at certain age for certain group of people. Okay, we have the young, we have the adulthood, and we have the elderly. What are the things that can be done that you should be aware of at all these stages? So if the healthcare professionals all over we should make it like a point of duty for us in our hospitals, in our community centers, in clinics, even in religious groups, to create awareness to people, let people know what they should expect. Like the scenario you gave just now, women should know that, okay, from the age of 40, they should expect so they are moving close to menopause. There will be some premenopausal symptoms that will be coming up: headache, hot flashes, lots of appetites, majority of all these symptoms. And at times, if you are not very careful, when you start experiencing all these things, you just believe, this one, there's something wrong with me. And it's possible for you to take paracetamol. It's possible for you to take some things and you will not feel better. And you will think, no, this is the work of the devil. They are after me. They are after me now. And the next thing we do is start running etasketa, going to mountains, coming down from mountains, going to churches, going to visit prophets and so on. And it will not really do anything, because the symptoms will still be there. But if you seek medical help on time, there will be solution. And so for you, when you are aware, the self-prevention is better than cure, right? So when you are aware of these things, you know the measures to take it, to put in place. Do you understand? To reduce the effects. Because there are some things like this menopausal symptoms. There's nothing you cannot do. There's nothing you can do about it. It's just natural. So it will come at its own time, and it will go at its own time. There's nothing you want to do about it. So creating awareness, enlightenment, doing life-saving programs, this can really go a long way.
Okay, thank you very much. So you've heard from the horse's mouth. Awareness is very, very germane, so that everybody is aware. When you are having a certain type of symptoms, you know that this is symptom that requires medical attention. It's not something that needs you to be running into spiritual houses here and there. They are just issues that require pure medical attention. Yeah, I do also think that the religious houses also have a role to play in this.
Saving programs, this can really go a long way.
Okay, thank you very much. So you've heard from the horse's mouth. Awareness is very, very germane, so that everybody is aware. When you are having a certain type of symptoms, you know that this is symptom that requires medical attention. It's not something that needs you to be running into spiritual houses here and there. They are just issues that require pure medical attention. Yeah, I do also think that the religious houses also have a lot to play in this awareness.
Yeah, that's what I said. They have a lot. In fact, they have a lot. You know, in Africa, we so much embrace religion in such a way that we embrace it more than our own life. So if in religious groups, people can really, like maybe a church, for example, maybe we have doctors, we have nurses there, we have community workers there, that they really know about all these things. During programs like women program, men's program, let's call experts. that can come over. Let them invite doctors, let them invite nurses that can come over and speak about some topics. Do you understand? And also bring about some equipment, no matter how little it is, to check people around and say, okay, what can we do for this one? Okay, the BP is going higher, it's not supposed to be in this range, what can we do? The sugar level is not looking so good, what can we do? When all these things come on, because there's nothing, most of us, at least 80% of us in Africa, we believe what our pastor says, we believe what our imam says. So if our religious leaders can really even inculcate all these things, it will go a very long way. So they play a very vital role.
I do also agree. I agree with that 100%. That our religious leaders in Nigeria and Africa at large, they have very serious role to play in giving awareness to their member concerning healthcare delivery acceptances among the populace in Nigeria and Africa at large. Now, that takes me to the fourth question to our guest here today. In the year 2023, there's a report from WHO.
Okay.
The report stated that Nigeria has the second highest maternal, stillbirth, and neonatal deaths in the world. Wow. That was just last year, 2023. It was reported that out of every 1,000 women and children, 540 die. That is 540 deaths per 1,000 women and children. That's a report from WHO. Now, despite this particular report, we have seen instances in Nigeria whereby our religious leaders still openly preach against pregnant women taking vaccine, children taking vaccine, polio vaccine, preaching against it. Some believe that it was a mean by the Western world to reduce the African population by giving the children polio vaccine, and this has created a lot of issues. We even have issue whereby religious leaders openly preach against their members who are pregnant, going against having CS, even when they know that natural delivery will pose a risk to those women. They still believe that CS is the work of the devil. And in some instances, we have seen whereby by trying to give birth naturally, some of these pregnant women they've lost their lives. So the question is, in your own opinion as an expert, do you think that in this 21st century, CS should still be an issue to be seen as the work of the devil?
No.
For pregnant women?
No, not at all.
Okay.
I will say that research is the figures is very these figures is very scary to me, honestly. And I will say, I don't know, cesarean section is just a surgical procedure.
Okay.
Just to incise the abdomen, open up the uterus and bring out the baby. Nothing more. There is not that there is anything special. It's not that there's anything hidden that is done more than that. So I don't know why we Africans tag any woman that goes for cesarean section as if she's lazy, because that is the word. Because I was a scrub nurse in obstetrics for almost 10 years. So we've seen a lot of men that will bring their wives over to the hospital, and the doctor will recommend, okay, we are going to do a cesarean section because of one thing or the other, and the next thing you will not see the husband again. You will not just see them again. They will be nowhere to be found. And you see some of the families, especially the family of the man, the woman is lazy. Why is she lazy? Can't you see other women giving birth through normal delivery? Why is that different? And you start thinking then that, why are all these people thinking this way? Because you can never see a medical doctor that will just come to you and say, Madam, you have to do CS now. It's not even something that all of them will want to go through, because we have a lot of patients that they have to attend to. So even you taking you for CS and is another job on its own. So it's not that maybe the doctors really love doing that every time for every woman that come across them. No. There must be an indication that would have prompted them to say, okay, we want to do an operation, especially maybe if the baby is big, if the baby is not feeling too well, the baby is not doing well inside, maybe fetal distress, maybe the positioning of the baby is not really okay for vaginal birth, or many issues. It can be because maybe the pelvis of the mother is not really even fit for vaginal delivery. And on the aspect of the mother too, there are many indications. It may be because it's operation, especially maybe if the baby is big, if the baby is not feeling too well, the baby is not doing well inside, maybe fetal distress, maybe the positioning of the baby is not really okay for vaginal birth, or many issues. It can be because maybe the pelvis of the mother is not really even fit for vaginal delivery. And on the aspect of the mother too, there are many indications. It may be because the mother is having high blood pressure, or she has a gestational diabetes. These are issues that can be an indication for CS. So it's not, we should remove this mindset of the woman is lazy. We should remove this mindset that the woman is a witch. She just wants to waste her husband's money. She just wants to do this because that is all their word. You want to waste your husband's money? Why can't you give birth through normal ways? Blah blah. And it's not really good even for the mental health of the mother. Yeah. Do you understand? So there's nothing evil in cesarean section. In fact, I will say cesarean section mothers are even doing more, because even after the CS, despite the fact that there will be pain control accepted, but you will still feel the pain. So even what they are feeling is even to me is more than vaginal birth. Like myself, for example, I've passed through the two, so I can say the differences. You understand? I can really mention the difference that okay, it's not that maybe a child that you gave birth to through CS, a true vaginal birth will be better than the one you gave birth through CS. So why are we creating a bad mindset and discouraging women? And I think that's why we have these scary figures there. That is so bad. If it's in this 21st century we are still having as high as that maternal mortality, that is just too high. So nothing like that. Nothing like all this misconception. The woman is lazy, the woman is a witch, the woman is this, the woman is that. And in fact, there's a word that I tell you, anytime I hear it, some of me and my colleagues will just laugh over it. They will say, if you give birth through CS, you are not a real mother. do you understand it? You are not a real mother. You've not really feel that how do I put it? Oh, you've not really felt the pain of giving birth. That's the word. Oh, and I don't know why we just put all these things out, and even apart from this issue of CS, discouraging people from doing CS, there are some women that no matter what you tell them, no matter what their doctors tell them, no matter what their midwives tell them, they will not agree. They will still go for that vaginal birth, and at the end of the day, it will even pose a risk to the child. There are some children that later will now have developmental problems when they are growing up. We have a lot of them. So viewers, I will say there's nothing bad in CS as long as it's an indication for it. And if you know you are confused, just ask your doctor, ask your midwife. You have your right to ask your midwife and your doctor, please, can you tell me why I should do this? Can you tell me the advantage? Can you tell me the disadvantage? Their job is to tell you, then you make your choice. But I know a medical doctor will never tell you should go for CS when you don't really need it.
Thank you very much for that robust response. So you've heard from the experts, CS is never the work of the devil, and no medical person will tell you to go and do CS if they do not see any need
for it. Yeah, any reason.
So you should have that in mind. I go to the next question for our expert here today. Now, we've seen some cases, especially here in Nigeria, whereby some people, the rich, the middle, the poor, have been reported to have slumped and died. We've seen the cases of celebrities that have been reported slumped and died. We've seen the cases of politicians in Nigeria. We've heard of many cases that slump and they die. Now, the problem is that in some of these instances, people have always attached some different level of sentiment and colorations to the causes of their death. Some believe that it is, as we said, it is village people, it is the work of the devil, and in some instances, the causes of this death, they were just, some were having BP, some were diabetic, they don't know, or they don't believe that they have it.
Yeah.
Some were not taking enough rest, some were not having good diet, some were not monitoring their weight and others. Now, can you enlighten the viewers on how to take control of their health, especially in these areas that we've mentioned, BP, having enough rest, check your sugar level, weight monitoring, nutrition, and others?
Okay. Yeah, thank you. There are many ways in which you can control your health, and I will relate some of them to the specific areas that you mentioned. First of all is plan your diet, plan your meal according to what is good for your health.
Okay.
Is another thing to eat. Is another thing to eat healthy. Do you understand? It's another thing to eat. Is another thing to eat healthy, because it's not just for you to eat. It's for you to eat healthy. So when you eat, you make sure that at least you make it, okay, we say we don't have balanced diet again, but at least you make it a bit healthy for yourself. Don't just take enough of carbohydrates without veggies, without fruits, you understand? So just plan your diet, plan your meal according to what really suits you and what really suits your health. And secondly, I will say, take care of yourself by reducing your stress level. We know it's not easy everywhere. Everywhere people are busy, people are searching for money, up and down. We look for money, we go to work every day, we come back, we do this, we do that. But at the same time, our health is very important, so we have to take control of it. So many of all these people slump at work, you see some people slump at work, slump while they were driving, all these things it is an accumulated stress that, as you know, it's just like car that we drive everywhere on the road. It will give you signal before breaking down. So that's how our body is an accumulated stress, most of it that leads to all these things. And some of them would have been the BP patient, they will not even know. Some of them will be diabetic, they will not even know. So take care of make sure you reduce your stress to lower it to a minimum. Then make sure you have enough sleep. Take enough rest as you can. Even if you can't take during the day, make sure in the night to take. And those people that are doing night shift, make sure when you come back from night, make sure you sleep. Don't go to night shift and come back again and go and do morning and come back again and you just feel like, oh, my body, I'm okay, there's nothing wrong with me. It's not always like that. Take enough rest. Stay hydrated.
Okay.
Take enough water. Make sure you are hydrated. Make sure you take enough water per day. Do you understand? At least 2,000 ml to 3,000 a day. Make sure you take at least 2 liters. That is about 2 liters, 3 liters per day. That's the recommended water level that at least you should take per day. But most of us we don't really take water, and water can really plays a very vital role in our system. So let's take enough water. Then make sure you visit your doctor often. Make sure you go for checkup. Then monitor your weight. Make sure you monitor your weight. Because when you don't monitor your weight, before you know it, you don't even know when you'll be overweight. You don't know when you are malnourished. And on the other hand, when you are overweight, before you know it, it goes to obesity. And when you are obese, this gives rise to a lot of cardiovascular diseases, and which is not really good for our health. So monitor your weight well, rest, take enough water, reduce your stress level, and eat healthy.
Thank you very much. Monitor your weight. We've heard from the experts that some of these deaths that we have seen, they were not as a result of village people. Some were as a result of the fact that we are not taking good care or control of our health. So we should try as much as possible to check our BP, check your sugar level, have enough rest, all those stuff, as our expert here have highlighted. Yeah. Now, my next question is the fact that it's a two-in-one. Is there a particular age that one can be exposed to having BP or being diabetic? And if one is diagnosed of any of these, is this a death sentence?
No, no, no.
Because a lot of people, sorry to cut you off, a lot of people, we've seen cases around us whereby as soon as someone is told that he has diabetic, he begins to cry, he or she begins to cry and think the life has ended. You know, people have this subconscious thinking that when you are diagnosed of being a diabetic or having BP, then you should be expecting your death.
So that's so funny. And everything still boils down to the topic, religion and cultural beliefs. So you said, is there any
age?
Is there any age that one can be exposed to
BP or being exposed to?
Yeah, I would say there's no age.
Okay.
Especially in this 21st century, because many things have really changed. Because we see even young adults now that are having high blood pressure, and but the older you get, the more you are at risk for them. Let me put it that way. The older you get, the way a 20-year-old, 25-year-old we have a lower risk is different from how 40 and above we have it. Like diabetes, for example, we have two types. We have type 1 and type 2.
Okay.
So the type 1 is from early childhood, but the type 2 is for people that are older than 40 years, that are more exposed to that, older than 40 years old. So when you are at that age, like I said it the other time, age 40 and above, you just have to, if you've not been taking care of your health, just as in make it like a duty to do from age 40. Don't take anything light. Don't just take anything with levity. Make sure you take your health serious. So from 40 years and above, make sure you check your sugar level. What's my sugar level? Is it okay? Is it moving toward pre-diabetes, so that I can know what to do on time, so that I don't get to that level of diabetic? Then for hypertension too, is the older you get, especially 40 years and above, start checking your blood pressure. In fact, I will advise, as long as you have the money, I don't know why we cannot have, each family cannot have a blood pressure monitoring device at home. A lower risk is different from how 40 and above we have it. Like diabetes, for example, we have two types. We have type 1 and type 2. Okay. So the type 1 is from early childhood, but the type 2 is for people that are older than 40 years, that are more exposed to that, older than 40 years old. So when you are at that age, like I said it the other time, age 40 and above, you just have to, if you've not been taking care of your health, just as in make it like a duty to do from age 40. Don't take anything light. Don't just take anything with levity. Make sure you take your health serious. So from 40 years and above, make sure you check your sugar level. What's my sugar level? Is it okay? Is it moving toward pre-diabetes, so that I can know what to do on time, so that I don't get to that level of diabetic? Then for hypertension too, is the older you get, especially 40 years and above, start checking your blood pressure. In fact, I will advise, as long as you have the money, I don't know why we cannot have, each family cannot have a blood pressure monitoring device at home that we can use to check our blood pressure frequently, so that if you see that it's high more than what's supposed to be, because it depends on how old you are, that we can say, okay, this one is normal, this one is high. The blood pressure for 60 years, 70 years old is different from the 30 years old, 35. At least slightly, a little difference to say, which I cannot really expatiate on this topic. But make sure you take your blood pressure frequently, so that if you realize it's going on the higher side, it's better you consult your doctor immediately And like you said, it's not a death sentence at all. There are many people living with hypertension for 20-25 years and they are doing very well. They are doing really good, pretty well. So we don't have to believe that when I'm diagnosed of I'm having hypertension, I'm having diabetes, then I'm dead. No, not at all. It's not like that. The only thing you need is just follow your doctor's order. What they tell you to do, do it. Like high blood pressure, for example, I think the only thing you have to do when you take your drugs, just go lower on your cholesterol and your salt intake. That's all for feeding. You are free to take as many things as you want to take. It's on the diabetic side that you can say, okay, you have to monitor what you eat. You don't have to take some things, you don't have to take some things, but still, this is a thing that if you really want to do, for you to maintain a good well-being, you can do it. So it's not a death sentence. Okay. Follow your doctor's advice. Make sure you go for your checkup often, take your drug, and like I said earlier, the positive aspect of religion, that doesn't mean we should not pray. God has the final say in everything. Is the greatest physician. So as you are taking your drug, following the doctor's advice on what to do, pray, and everything will go on well.
Thank you very much. We've heard that. So if by chance you have been diagnosed to have high BP or you are diabetic and so on and so forth, it is never a death sentence. So we should not see it as if that is the end of the world. All we need to do is to adhere to the medical advice that has been given to us by our medical expert. Thank you very much. Now, I think the next question I have next is that BP, diabetes, and such related diseases, are they hereditary?
Yeah, they are. Hypertension is hereditary, diabetic is hereditary, cancer is hereditary. So if one member of the family is having it, there is a higher chance of any member of the family getting it. So like hypertension, for example, and diabetic and cancer, when you know that, okay, my dad is having it, my mom has it, my sister, my nephew, my cousin, or anybody related to you, as you don't take it lightly, you make sure you start. In fact, the way you start your own medical checkup is different from someone that does not have the history at all. And that is why when you come to the hospital, one of the first things we ask is your history, the family history, the social history, so that if this thing is, if it's in your family, the way we know when you know that, okay, my dad is having it, my mom has it, my sister, my nephew, my cousin, or anybody related to you, as you don't take it lightly, you make sure you start. In fact, the way you start your own medical checkup is different from someone that does not have the history at all. And that is why when you come to the hospital, one of the first things we ask is your history, the family history, the social history, so that if this thing is, if it's in your family, the way we know how to go about it. You understand? If it has not gotten to the extent of, let me take BP for example. If your BP is not really on the high side, but you have a dad or a mom that has it or suffer from stroke before death also, so they will know that definitely you have a higher chance. So you see them giving you advice that you should come for checkup often before it will get to a state that it will no longer be controllable. So it's very hereditary, but it's not contractable. It's not that it's not that I'm having high blood pressure now, you are sitting beside me and you contract it. No. Okay. Yeah, but hypertension, diabetes, cancer, they are hereditary.
Okay, thank you very much. Yeah, dear viewers at home, you've heard from the horse's mouth. If by any chance, I'm just restating what our expert here has said today, if by any chance any member of your lineage, your family, has an history of being diabetic or high BP, then you should know that the probability of you having any of those diseases or illness is very high.
Yeah.
So, and that shows that we need to start monitoring ourselves as early as possible.
Yes.
Thank you very much.
Yeah.
In conclusion, do you have any other pieces of advice you want to give to our viewers at home before we call it a day?
Yes, thank you, viewers. Thank you for listening. I will conclude by saying health is wealth. There's no amount of money we have if we are not healthy. Life will not really be pleasant for us to live. But when you are healthy, you enjoy life more. So make sure you take enough rest, like I said earlier. Take at least 30 minutes of exercise 3 to 5 times a week, which is very good for us. In fact, on the exercise level, I think it's very, very vital for us to make it a practice. Even if you cannot do it outside your house, you can do it inside. There are many YouTube channels now that you can just click exercise for me to do this. Is it for you to reduce weight? Is it for you to reduce your fat? Is it for you to relieve headache? Is it for you to relieve backache? Just click on YouTube. You can do all this exercise right inside your house, even without going out every day. And then you take enough rest, like I said. Then do things that make you happy. Life is too short for us not to be happy. Do things that make you happy. Relate to people that make you happy. And just enjoy life the little way you can. You don't have to have all the whole world before you can enjoy life. Enjoy life, have a positive mindset, and also stay hydrated and go for regular medical checkup. And I will emphasize on that again. Go for regular medical checkup, especially when you are age 40 and above. Thank you.
Thank you very much. We appreciate the fact that you were able to come to this interview today.
Thank you.
And I do hope that if we have any reason to call you back on some other related topics, you'll be able to honor our invitation.
Yeah, no problem.
Thank you very much.
You're welcome.
Viewers at home, we have come to the end of today's interview or podcast, as it may be. But before I round off, I would like to state that I wholly agree with the submission of our expert here today with regards to the positive aspect of religion as it relates to healthcare delivery services, religion and cultural. But I do believe that they can be mutually dependent. We don't need to see them as mutually exclusive.
Exactly.
That maybe because you are a Christian, you cannot go to the hospital. It is a sin for you to go to the hospital. They can they can coexist. Yeah. You can go to the hospital and also be praying for the medication to work fast.
Yeah.
On you.
Yeah.
So that is my own opinion. So they can be mutually dependent and not mutually exclusive. Thank you very much. I still remain Dr. Kolawole Olayin Babatayo until we see next on the next topic. I say God bless you for now. Bye.
Bye.